Lobotomy, the surgery that was supposed to heal the mind. There was a time when doctors believed they could cut sadness out of the brain, cut away fear, cut away madness, cut away pain. And if the patient became quiet afterward, they called it success. In the middle of the 20th century, one of the most terrifying medical ideas in history was sold as hope. A surgery for the mind, a shortcut through the skull, a procedure that promised to calm the uncontrollable, cure the hopeless, and empty overcrowded hospitals. It was called the lobotomy. And for a while, people believed it was the future. Patients who were depressed, anxious, traumatized, violent, difficult, or simply misunderstood were brought into hospitals and clinics. Some were adults. Some were women whose families wanted them fixed. Some were soldiers broken by war. Some were children. And some of them walked in speaking, thinking, remembering, feeling, and walked out changed forever. Not cured, not healed, changed. This is the story of lobotomy, the surgery that was supposed to save the mind, but too often destroyed the person inside it. Before we judge the past too quickly, we have to understand the world that created it. In the early 1900s, psychiatric hospitals were overflowing. Mental illness was poorly understood. There were no modern antidepressants, no antipsychotic medications, no advanced brain imaging, no real understanding of trauma the way we understand it today. Families were desperate. Doctors were desperate. Institutions were packed with patients who could spend years, even decades, locked away from society. Some hospitals were underfunded. Some were overcrowded. Some were places where people were not treated as patients anymore, but as problems to be managed. And in that world, desperation became dangerous. Because when people are desperate enough, almost anything can start to look like mercy, even cutting into the brain. The idea began with the belief that emotion, personality, and mental illness were connected to the frontal lobes, the part of the brain involved in planning, judgment, impulse control, and personality. If doctors could interrupt certain pathways in the brain, maybe they could relieve suffering. At least, that was the theory. In the 1930s, a Portuguese neurologist named António Egas Moniz developed a procedure called the leucotomy. The idea was to sever connections in the frontal lobes of the brain. Moniz believed this could reduce severe psychiatric symptoms. And incredibly, in 1949, he would receive the Nobel Prize. At the time, this looked like progress, a bold new medical breakthrough, a treatment for people society had almost given up on. But history would later ask a darker question. What if the procedure did not heal the mind, but simply damaged the part of the person that made them themselves? In America, the lobotomy found its most famous and most controversial champion. His name was Walter Freeman. Freeman was not a brain surgeon. He was a neurologist and psychiatrist. But he was charismatic, ambitious, convinced. He believed lobotomy could transform psychiatry. He saw overcrowded hospitals, suffering patients, exhausted families, and an overwhelmed medical system. And he thought he had found a solution. At first, Freeman worked with a neurosurgeon named James Watts. Together, they performed prefrontal lobotomies in operating rooms. These were serious surgical procedures, but Freeman wanted something faster, cheaper, more accessible. Something that did not require a full surgical team. Something that could be done almost anywhere. And that desire led to one of the most disturbing inventions in medical history: the transorbital lobotomy, the ice pick lobotomy. The name sounds almost unbelievable, but it was real. Freeman developed a technique where a sharp instrument was inserted through the eye socket above the eyeball and driven into the frontal lobe. The instrument was then moved to sever brain connections. Often, the patient was rendered unconscious using electroshock. The entire procedure could take only minutes. Minutes. A few movements of the hand. A few broken connections. A life permanently altered. Freeman traveled across the United States performing the procedure. He gave demonstrations. He visited hospitals. He promoted lobotomy as a practical answer to a national psychiatric crisis, and the numbers grew. Thousands of patients. Then tens of thousands. In the United States alone, around 40,000 lobotomies were performed. Worldwide, the number was even higher. And every number was a person, a name, a family, a mind. For some patients, doctors claimed improvement. They became calmer, less aggressive, less distressed, easier to manage. And in a time when psychiatric hospitals were overwhelmed, easier to manage could be mistaken for better. But there was a terrible difference. A quiet patient is not always a healed patient. A compliant patient is not always a recovered one. A person who no longer fights is not necessarily free from suffering. Many lobotomy patients were left emotionally flattened, childlike, confused, passive, unable to work, unable to care for themselves. Some lost their personalities. Some lost their memories. Some lost their ability to plan, dream, or connect with the world the way they once had. Some died. Others survived, but only as altered versions of who they had been. And that is the most haunting part of lobotomy. It did not always kill the body. Sometimes it left the body alive and buried the person inside. One of the most famous victims was Rosemary Kennedy. She was the sister of future U.S. President John F. Kennedy. In 1941, when she was just 23 years old, Rosemary was given a lobotomy. Her family had been concerned about her behavior, mood, and independence. The procedure was supposed to help. Instead, it devastated her. Rosemary lost much of her ability to speak clearly. She could no longer walk normally. She required lifelong care. The surgery did not give her freedom. It took it away. For decades, much of her story remained hidden from the public. But Rosemary Kennedy became one of the clearest examples of what lobotomy could do when ambition, fear, and medical confidence collided with a vulnerable human life. And she was not alone. Most lobotomy patients were not famous. They did not have powerful family names. They did not become symbols. They disappeared into hospitals, institutions, and private homes. Their stories were recorded in files, or whispered by families, or forgotten completely. Then there was Howard Dully. He was only 12 years old when Walter Freeman performed a transorbital lobotomy on him in 1960. A child. Not a violent criminal. Not a hopeless medical case. A child. His stepmother reportedly described him as difficult, defiant, hard to manage, and Freeman agreed to operate. Think about that. A boy with a developing brain. A boy who should have been protected. A boy whose future was still unwritten. And someone decided to drive an instrument into his frontal lobe. Howard survived, but survival is not the same as being unharmed. Years later, he would search for the truth of what had happened to him. His story became one of the most disturbing reminders that lobotomy was not only used on the severely mentally ill, sometimes it was used on people who were inconvenient, troubled, misunderstood, or simply powerless. Lobotomy spread because it promised something medicine has always been tempted by: a simple solution to unbearable complexity. Mental illness is complicated. Human suffering is complicated. Trauma is complicated. Families are complicated. Institutions are complicated. But lobotomy offered a shortcut, a physical cut for an emotional storm, a procedure where there should have been care, a silence where there should have been understanding. And that is why its story is so chilling. Because it was not performed only by monsters in dark rooms. It was performed by educated doctors, in hospitals, under the language of treatment. That is what makes this history uncomfortable. The horror wore a white coat. But slowly, the truth became impossible to ignore. Reports of severe side effects grew. Critics spoke out. Patients were left damaged, disabled, or emotionally erased. And by the 1950s, the arrival of antipsychotic drugs like chlorpromazine began to change psychiatric care. Medication was not perfect. It came with its own serious problems, but it offered something lobotomy never could: the possibility of treatment without destroying brain tissue. As psychiatry changed, lobotomy began to fall out of favor. Freeman's reputation collapsed. Hospitals became more cautious. The procedure that had once been promoted as revolutionary became a warning. A warning about speed, about arrogance, about treating silence as recovery, about mistaking control for healing, and about what can happen when medicine forgets that a patient is not just a brain, but a person. Today, lobotomy is remembered as one of the darkest chapters in medical history. Not because every doctor involved was evil, not because every case was simple, but because the procedure revealed something deeply dangerous: the belief that human suffering can be solved by damaging the parts of the person that make them human. Personality, emotion, memory, resistance, desire, fear, hope. The things lobotomy tried to quiet were often the very things that proved a person was still there. And in the end, that may be the most disturbing truth of all. Lobotomy did not simply ask, how do we heal the mind? It asked something far more dangerous. How much of a person can we remove and still call it treatment? Because sometimes the most frightening medical disasters are not the ones born from cruelty. They are born from certainty, from doctors who believed they were right, from systems that rewarded speed over care, from a society that wanted suffering to become quiet, even if the person disappeared with it. And that is why the story of lobotomy still matters. Because the question it leaves behind is not only historical, it is moral. When we say we want to fix someone, do we mean we want to help them live? Or do we mean we want them to stop disturbing us? That is the shadow lobotomy left behind. A procedure once praised as a breakthrough, a surgery once called hope, a blade taken to the brain in the name of healing. And for thousands of people, the wound was not just physical, it was personal. Because the surgery meant to cure the mind, sometimes erased the soul.